All right, we're ready. Good evening and welcome to the General Board meeting for the Oakland Community Health Network. At this time, if you can, please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one. Thank you. Could we have a roll call of the board members, please?
Mr. Young.
Here.
Mr. Furman.
Present.
Dr. Giles. I believe she's coming because she asked me to pronounce it for her. Pastor Jones.
Present.
Dr. Guadalupe. Ms. Woodruff.
Here.
Dr. Hans. Here. Ms. Newman.
Here.
Ms. Root. Here. Ms. May. Mr. Torres. Here. Mr. Cowan.
Present.
You have a quorum. Dr. Giles.
Talk about just-in-time delivery. It's perfect timing. All right. Next, we need a motion for approval of tonight's board meeting agenda. So moved. Support. A motion and support. Is there any discussion? All those in favor say aye. Aye.
Aye.
Those opposed, the motion carries. We have an agenda. The next item is public comment. There are two opportunities for public comment before the board this evening. We ask that when you are recognized that you please address the board only, not individual members, and also that you limit your comments to 3 minutes. At this time, we traditionally first have individuals who may be trying to reach us online. Do we have anyone online?
If you are online and wish to speak for public comment, please raise your hand at this time.
No one online? I forgot to mention one more thing. If you do wish to address us, please state your name before you begin so we know who you are. Is there anyone in the audience who wishes to address the board this evening? There being no one, then we will at this time close public comment, and again there'll be a second opportunity for public comment towards the end of the meeting. I'll now call the meeting to order, and then we have our one of our favorite items every month is Stories That Inspire Hope, and tonight it is our very own board member, Pastor Jones, and the timeout team. So Pastor Jones, I'm going to hand over the microphone to you.
Thank you very much, and I'm going to pass this over to Trish, that she may introduce the program, and then we can talk about the activities of what we're doing. And we have just a great distinguished group of people here that I've had the opportunity to work with since May of 2024, and they've accomplished some great and spectacular things under so difficult positions and conditions, and that they've been able to show what hope can do, So, Trish, I'll pass it to you, and then we'll introduce our team.
Thank you, Pastor Jones. So you may have remembered approximately a year ago we received grant funding from MDHHS to target community violence. Within that proposal, we were able to contract with the Greater Pontiac Community Coalition to look and target violence within Pontiac. We also contracted with Chance for Life, which we've talked about a little bit here about reentry. But the majority of this grant has gone to the Greater Pontiac Community Coalition to establish this timeout team. Myself, along with Francis Carley, has been working with Pastor Jones and this team for about a year now, over a year now, since last January, and really working with them on everything from data collecting, which they'll tell you is their favorite thing to do, to providing mental health trainings, discussing trauma, and really having them be those boots on the ground out in the community. So I'm really excited that they are here today to share their story, share about the program and what they've been working on. And Pastor Jones, I will give it back to you, and we can introduce the the team.
Thank you. In addition to the efforts that this team has had to do, one, deal with peer mediation, conflict resolution, and violence intervention. The greatness about each one of these gentlemen is that they have spent some time incarcerated, a great deal of time. And they came out with the hope and the expectation that maybe they can make a difference, not just from strangers, but also from family members. The idea was, how do I keep my younger brother or my cousin from traveling the same route that I did? And so they've committed themselves to saying they can make a difference. And the opportunity that we have with this grant that has been given to us, and I want to thank our board chair, our CEO, for including us in that as we looked at Chance for Life and how do we curb violence. Since this group has been in existence, from the month of May of 2024 through September of 2024, and as a matter of fact, I can take a little further, almost to the end of the year, there have not been any homicides in the city of Pontiac, which is a great achievement because of their involvement, their engagement, and their participation. And so I'm going to let them tell their story, where they came from, and I shouldn't say I'm going to let them. I guess they'll permit me to introduce them so they can do it. So we have you come to this. I think we maybe space for 2 or 3. You guys are going to speak. The 2 gentlemen coming in front of you are part of the originators of the program, and we were able to pull in others into that program as well. And I'm going to just get this out of the way right now. Let me introduce to you the rest of this team that's here with us. And I'm going to start over here with my buddy George. So I want to introduce him. Thank you, and he can. All right.
Sorry about that. How you all doing? I'll start over. Well, I'm from Pontiac. My name is George Walton. I work with the Timeout, and we taking it one day at a time, coming together. I'm a little nervous, but we're here. But as I was saying, we've been doing a lot for the community, working with the kids, taking them on trips. I'll tell you a little more.
Thank you. Maria?
How y'all doing? My name is Imarion Foster. I'm part of the community violence team. I just look forward to, trying to help my city, and I'm willing to put myself on the line if I can stop my younger brothers and my family members from going down the same path I went down. I appreciate y'all for the opportunity, and just looking forward to seeing where we go.
Good afternoon. My name is James Sampson, and of course, I'm with the Timeout program too. And like they said, we just been trying to better our community because we've been doing so much wrong in our community. So younger. So now we're trying to do better in our community and trying to just stop the violence if we can, and help the children, and try to steer them in a better path than where we came from.
Thank you.
How y'all doing? My name is Dwight Chappelle, and I have the privilege of working with these remarkable guys. Just like they said, they truly put their lives on the line, and they're all about their community. I think they're more like family than friends, which makes it a perfect place for me to be. Thank you.
How long were you in prison?
18 years.
James? So, everybody has a past. Everybody has a past. I always say to people, everybody has a moment when maybe you take a wrong step. But the key thing is, how do you get past that moment? And what do you do when you decide to make a change in your life? And that's what these young gentlemen have done. That's what they've done. And if you look at them, you wouldn't think that they had been incarcerated or whatever. But they're saying we can make a difference, and they are making a difference. So with that, I'll turn it over to Elijah and also to my friend Bugs.
Good afternoon, everyone. I'm Elijah Lomax. I'm a lead of this program. A little bit about myself. I spent 8 years incarcerated. I came to this program in May of 24 through the help of GPCC and OCHN. They gave us the opportunity, and we structured a program called Time Out. Now, the basis of the program is, of course, to solely stop the violence and curb some of the violence and get a hold of the youth. In our city where we've come from, it's dangerous. You have children at the age of 10, 11 years old carrying guns, making guns. So, with that being said, we try to grab those children and try to do something productive with them. We've taken them, ice skating. We've done toy drives, gave away food to the community. So we don't just stop the violence. We give back to our community as well. We have countless situations that our team has mediated and navigated through influence. People respect us. We respect our community. I'm honored to be here. I can't say 10, 15 years ago I thought I would be doing this, but it feels good to give back to the community. It feels good to do something right. It feels good when I wake up in the morning and my daughter looks at me and she thinks I'm a superhero. Like Dad, you about to go save the world, and it just does something to me. So I'm honored, and with my brothers here, we've came together, and we've been putting a stop to it. Like the pastor said, it hasn't been no homicides, and that's like amazing. So we continuing on this journey. We growing as we go through, growing pains. We've been taking this training for trauma, and throughout it, we recognize how to deal with people differently. So I'm just honored to be here. Like I said, like my brother said, we taking it one day at a time and moving forward, and we plan to continue doing the great work in our community. That's what I have to say. Thank you.
Turn your mic on.
I'm the other lead inside of the program. My name is Quandale Buggs. I'm also responsible for the data inside of the program. I'm honored to serve for this program. Like, this program has done so much for me. I'm one of the individuals that was incarcerated for a very long time. I was incarcerated for 17 years. I was released in August of 23, and I came home with a renewed vision of what my life should be. And Time Out has given me so many different opportunities, like, to help some of the stuff that I used to be a part of. So I'm greatly honored to be a part of this program, and I stand behind each and every one of those men you see. They out there with me daily, trying to do this
very hard job at times. And, you know, I just wanted to just make a positive impact in my community, you know. So, like he said, we done took children skating at the Little Caesars Arena. We was responsible for over 350 bags on Thanksgiving. We donated over 400 coats to the Oakland County School District and the Lighthouse. We've been active inside our community, and we definitely been trying to like curb this violence thing that's been going on in Pontiac. And you know, I feel like through influence, it's been working. You know, we've been getting all of the training and stuff to help us better understand and dealing with these situations or whatever. But we effectively dealt with domestic violence issues. We done had gang violence issues. We done had assaults, or we had to relocate people. You know, we've taken on some very serious situations that, you know, had it not been for these guys, you know, putting it all out there, it would have been a different outcome a lot of times from a lot of these situations. So I'm honored to be a part of something that's actually curbing the violence and not, you know, adding on to the flames. And like I said, this team and this experience is everything, and I'm honored to be a part of this, and I'm honored to stand beside these men and help Pontiac become a safer place. So thank you.
Thank you very much. Pastor, anything you want to add before we go around the table?
You know, I just want to, you know, mention the commitment. You know, we meet, we have a standard meeting date every Monday, 2 o'clock, and it goes to about 3:30, 4 o'clock. And I would tell you the first time we set our meeting time, some of the guys came in at 2:10, 2:30, 2:45. And we said, hey, that's not professional. That's not professional. So we got to make sure that we do. If we're going to ask other people to do something, we have to do it ourselves as well. And so they you know, and it becomes a group decision to say, okay, we're willing to do this. You can't make people do. People have to have a desire to do. And because they had that desire to make a change, they wanted to show that they could be different, if they could set a time pattern, that they could set an image pattern to make sure that people looked at them differently than they would have looked at them before. And so they've done this. And so, you know, parents call us, people call us, schools call us, say, can these young men come over and speak to our children? And they do it. You know, when they went ice skating, some of them packed more ice than they skated on it, but that's what happens. You know, you learn, but they had a lot of fun, and it brought a lot of camaraderie. Now what we're looking at is saying, okay, now how do you deal with the trauma? Because they had to deal with their own trauma first to be able to help the other people deal with theirs, to be able to understand. And I'll tell you about George. You know, every day George sends a Bible verse out, a Bible verse for us to think about, to contemplate, because that makes us think about where we are and what we've done and what we could do. So, you know, all I've got to say is a great program. Thank you, Madam CEO, Dana, for including us in the program. Thank you, Trish, for the work that you do. And we know there are other steps. You know, we're about to embark on another program, you know, that says, I think it's VPG. Vaping, no. Pills, no. Guns, no. Because we know that most of our kids are engaged in vaping now. And so we want to address that. And we can get rid of the vaping, we can get rid of the pills. We get rid of the pills, we can get rid of the guns. So you're going to hear a lot more from us on that. But just an exciting group to work with. There are girls in the group, ladies in the group, so I know y'all just want to make sure you know that. And I know you're going to come and ask that, right? And I tell you, the ladies in the group that we're there too, they do a great job, an outstanding job. And they deal with mama-baby drama, or mama-daddy drama. And they also deal with domestic relationships and what have you, and respect. respect and acceptance. So that's what I got to say, Mr. Chairman, and I will turn it over to you and the board for any questions that they have. And if you ask me how proud they are, I'm very proud.
Okay. Sure. What we do is after we have a presentation, we let some of the board members either ask questions or make comments. So we're going to do that. So, yes.
Okay.
What age groups are you working with?
We more so work towards with the older, like teens, adults. So we more so in the like 17 to like
35.
35, 17, 35.
somewhere in there.
We have had some
Some
incidents
that's been a little younger
though.
at times. But
Okay. And the conflict resolution, is that usually done at a facility, or do you go like to schools and do conflict resolution, or is that done in the community somewhere?
It's done, excuse me, I'm sorry.
Go ahead.
Conflict resolution is done anywhere where, like, we literally get phone calls to situations. We've been in situations where things just transpired and we just didn't even know nothing was going on, and just it happened like that. Like, so being boots on the ground, like being out there in the community, it can happen in a corner store, it can happen at a school, a neighborhood, so everywhere pretty much.
Okay. Thank you.
Yes, ma'am.
Christina?
Hi, I'm wondering if you could share the phone number or email address for the program?
So the email address is timeout2024cvi@gmail.com.
Okay.
And we do have like personal numbers, like
Okay.
like we have.
every member, but we mostly go through that.
Yeah, we mostly go through, yeah.
Okay. And then I just wanted to say thank you so much for coming and sharing your stories. It means a lot. I know it can be kind of nerve-wracking talking to a group in a room like this, but we really appreciate it. And your efforts now more than ever are so needed. There's a lot of fear, a lot of loneliness, a lot of hopelessness right now with the state of our country. Not to bring down the energy, but what you're doing is working against that. And you just don't know who you could reach. So thank you so much.
You're welcome.
Thank you.
Chad?
I'll just echo what Christine said. Thanks for coming. I mean, it takes courage to come and present, and appreciate you guys being here. And I've gotten to know Pastor Jones, who works at the OU Pontiac Initiative, and back in the 90s, worked at St. Joe's, and you know, you guys are doing great work, so appreciate all the efforts and energy.
Thank you. Thanks for having us. Appreciate you.
John Paul?
What's the referral process to refer somebody for the program? And is it just for Pontiac kids, or do you guys go outside of Pontiac?
As of right now, we're stationed in Pontiac. We have had situations that transpire from Flint to Pontiac, but we're mainly focused on Pontiac right now. I mean, now the referral process, it pretty much goes like a person, like we constantly watch Facebook, you know, in our city, Facebook is big.
Our drama zone.
It's our drama zone, yeah. Facebook and Instagram, like we see something, the guys might see something and we attack it. We, you know, inbox. We might not even know the person.
Mm-hmm.
Hey, what's going on? They look at us weird, stuff like that, but we stay on it like, hey, we not the police, and then we just trying to see what we can do to navigate this situation.
Mm-hmm.
And the referral process you were speaking of, like, for this program?
Yeah, like if you know of a youth that's at risk and would benefit from such program, would we just give them like the email address, or could we send you?
Well, we
an
more
email?
so like hands-on in those type of situations.
Mm-hmm.
Like we try to that's the unique thing about this program. It's like when we get a case, like when like for instance, in that case where you talk about somebody who may need like some type of like wraparound services or something like that. Yeah, we're more so like hands-on with it, and we may bring that person name to the meeting, and once we figure out what we do with them, we know what direction to go with them or what type of resources we may have to provide them. But we definitely like to be hands-on with those type of situations where we there with that person and not just telling somebody just to go get that. You know, I'm sure she can vouch. I done called about housing and I be on it, so we try to give them the resources for sure.
And yeah, I just want to touch too on the fact of how important it is for youth to see people that look like them. You know, that's a huge thing, is to see men doing the right thing that look like them and, you know, can set the example, because that is not to be underestimated within our communities. And then another thing is, I'm not sure if you guys do this already, but one thing, I worked in juvenile justice for many years, and we used to run a young professionals group, similar to what you guys had. We had a team that would go in, but they started doing a young professionals group where they would teach teenage kids, you know, how to dress, having a nice suit, how to have a nice dinner, how to sit and, do a dinner, and just how to act in a very professional manner, which I felt it went a long way, and it was very beneficial. Those are the kinds of things. I grew up the first part of my life in Pontiac. Used to box at the Azteca gym over there. Yeah,
my man.
Yeah, all three of me and my brothers, in the 80s and the 90s. But a lot of that, what we had from the community and growing up there, we learned about our culture there, and about the greater Pontiac community, and it was very beneficial for me. But there was components to that too, where they would teach us about being, good students and being, trying to act professional, and, a handshake and looking people in the eye and honor and those kinds of things. So I'm sure you guys probably do all those kinds of things, but I'm just kind of putting that out there that I've seen some success with that in the juvenile justice world of, a lot of people don't, they don't have a suit, or they don't know to have at least one nice outfit, that you can go professionally, or how to sit down, and have a dinner, and those kinds of things. But it's awesome. It's really inspiring to hear the work that you guys doing in my hometown. So it's awesome.
Appreciate that.
Yeah.
I'm very proud. I was born and raised in Pontiac, so y'all just don't know how you blow me away, because I'm active in the community. I've been in groups and in meetings where Pontiac was not spoken of in good terms. So to be able to hear a presentation like this and know that it's black men standing tall and doing the right thing is very satisfying, very rewarding, very exciting. Don't stop now, don't stop now.
Thank you. Appreciate that.
I just want to add a little bit that you guys might have forgotten to mention, but they've gone through many hours of training as well. Not only did they have to sit through a full day of training by me and Francis and some of our team here at OCHN, we contracted with some CVI specialists through our grant with the state to provide them specific training on doing this work. Them themselves wanted additional training on trauma and mental health and really anything else that we throw at them. But they are out there as well promoting our services and trying to get people the assistance and the help that they need, whether it's texting me about, housing and finding contacts, or trying to get someone to access services, or getting mental health, or even inquiring about mental health for themselves. So this is an extremely great group. Frances is online. I already got a text that she's sorry she's not here.
Hey, Frances.
They work very closely with Frances and that. But it's really exciting to see this and to see it grow with this group. So I'm incredibly proud of each and every one of them and everything that they've been doing.
Thank you. Appreciate that.
Can I make one other statement with what fellow cohort, Mr. Torres, mentioned about helping someone else or referencing. One of the experiences that Elijah had, and I'll let him talk to you about it, we were working with kids in another school district, and this one kid was just really a problem, and they couldn't understand why he was acting out. And Elijah went and started talking with him, and guess what? He just told. Do you want to tell him about the haircut?
Yeah. So, as the pastor was saying, we was doing cross neighborhood work, cross neighborhood training, and I was in Detroit with another CVI group, and they brought me along to the school where they, mediate situations. And it was this one in particular kid. He was bigger than me, but he was like in like the 7th grade. I'm like, man, you big, and the teachers kept putting him out of class because he wouldn't take his hood off. So my buddy was like, me and him clicked because he asked where I'm from. I'm like, I'm from Pontiac. He said, I just stayed in Pontiac. My family moved me to Detroit and whatnot. So I got to talking to the young man, and I'm like, what's going on, man? Why you don't take your hood off in class? Like, you keep getting in trouble for the same thing. And he looked at me, and he was like, man, 'cause they be talking about me. I'm like, what they be talking about? Like, what's going on? He's like, I don't got a haircut. I'm like, you don't got a haircut? And it kind of struck me because I'm a barber too, So I spent some time with the young man, spent some time with him, haircut, got him together. And I call and check. He calls me to this day still right now. He'll still call me and check up on me but he's doing good. He's doing good. He's playing for the basketball team now. But the teacher couldn't understand, they just kept kicking him out of class, never asking what's wrong or what's going on. Like, you won't take your hood off, you got to go. And it was simply because the kid needed a haircut. Something, really something.
Right. Yes.
Thank you, Mr. Chairman.
Well, yeah, I will, Sarah? Yeah.
I'm trying. Oh, there we go. No, I just wanted to thank you all for being here to share the success that you're doing. I think a lot of times when folks come out of being incarcerated, there's a lot of bias and stigma in the community, and you have completely broken that down by the actions that you're doing, the connections you're building in the community, and just you can tell even the short time that you talk, the sense of community and family that your group shows. So congratulations, and be proud of yourselves for all that you're doing for the community. Thank you.
Appreciate you. Thank you. Appreciate that.
Yes, Dana?
I want to say thank you so much. You guys are thanking us. We should thank you. We have these strategic priorities and things, and you're hitting every single mark. I'll tell you that. And the biggest thing for me is the fact that, and we can't underestimate or understate this enough, no murders or homicides in Pontiac since you started in September 2024. That is huge, and we applaud you for that because you're saving lives, and you're changing the pathway of these young people and yourselves with each other. So I can't thank you enough. We just have to find more and more resources to continue to support you in the best ways we can, because we look at what we call the social determinants of health, what we call really integrated care, but you're doing it. You're hitting on their mental health, their physical health, their social health, their economic health with education and jobs, and then also their spiritual health. So you guys are amazing. You're saving lives. So thank you. And I'm sure you save each other quite a bit. So I really do thank you, and I wish we could duplicate this in other places. And we just got to keep it growing and going.
Yes, ma'am.
That story you just told is so impactful because I used to work with kids, and it was the simplest thing. They would get in trouble. Instead of getting them in trouble, talk to them and find out what's going on. Yeah. And you guys are doing that. So thank you so much for your work.
Yes, ma'am. Thank you, too.
Yes, Dr. Giles.
All right, I'll try to keep it simple. I want to say thank you for being a positive presence in the community, not just in Pontiac, because we know Pontiac gets a bad rep. It's dangerous, right? So people come from other communities with their behaviors and create more unsafe environments within Pontiac. So you're impacting not just Pontiac, but our community, Oakland County, Wayne, you mentioned Genesee, Flint. So thank you for that. And then I also want to say, I'm a psychiatrist, so I was especially excited to hear that you all receive training in trauma because you're able to understand why someone may behave the way they do. And each of you talking, some of the things I heard, you work with people one-on-one. You weren't judgmental. You weren't standing back, talking down. You go to the site of the incident. I'm sorry, thank you. You go to the location of the incident. You work on site. You don't stand, give a phone call to, across town to talk to someone. You're right there, you're one-on-one, and that's really important. And it's also important that you weren't judgmental because just like with the young man you mentioned, it works for children as well as adults. Sometimes we don't know why adults behave the way they do, right? But by going to them and communicating, it's impactful. So again, thank you so much for your presence.
Yes, ma'am. Thank you.
All right, Dr. Hans, please.
Well, I was going to save my comment for the board comment section. I'm not only inspired, I'm awed by you, all of you. In my professional career, I like to think that I might have saved some lives, I don't know. But you really are doing amazing work, and I respect you for that. Thank you. You are truly an inspiration for us. Thank you.
Thank you. Thank you, ma'am. Appreciate that.
So, Mr. Chairman?
Yeah.
I'd like to make you a member of the team.
Well, pin me up.
Oh, no, I'll do it myself. And let's get one for the CEO, and I know they have one for each one of you so that you can, I'll let them distribute them themselves.
Can we also get a picture for our grant?
Just before, just one last thing. I'll kind of back clean up here. So we have this every month. I've been coming here for almost 5 years, and you can tell by the comments. This is, I think we're all deeply, deeply impressed by what you're doing. Somebody mentioned influencers, and a lot of influencers are selling a product, or they're selling a lifestyle, or they're selling something somebody wants. But the real influencers are you gentlemen, because as has been mentioned, you are saving lives, and that's so important. You may not know, we have a program where we're working with police officers, training them to deal with crisis intervention with people with mental health issues, to in essence, prevent violence. It just dawned on me, you're doing the same thing, except at the grassroots level, right where it counts. So I love the fact that as an organization, we're trying to approach problems from different places, because there's no one answer. It comes from everybody being involved. And I just have to tell you, you speak, you probably don't believe it, but listening to you speak with the strength of conviction, authority, and gravitas because of your shared experience, I don't see how anybody could listen to you and say no. I certainly couldn't. So thank you from our organization. Please keep up the good work, and we hope we'll be able to continue this work with you because it's so very important. And the results, as Pastor Jones has said, are showing not already in a short period of time when people in the community take care and they step up. And I want to thank you for your bravery, because I'm certain you've been in some situations which are not pleasant. And it put yourselves on the line. This means a lot to all of us, so thank you very much.
I appreciate it. Thank you. Thank you. Appreciate that. Thank you.
Okay, so we want to get a...
Want to get a quick picture for our grant? We can submit it to...
Oh, yeah, for sure.
Well, we want all of you and the whole board together. Let's get up here. Come on. We're all going to get up here. All right, call people in the back. it is gonna be hard to beat that. That was, I'm just gonna say it, we do a lot of things, but that was special. That was really special to hear about that. Yeah, exactly. Thank you. We gotta find out who gives out those grants and make sure that gets renewed. That's the most important thing. We're gonna have to go to battle for that. Okay. All right, we'll continue with the rest of our meeting agenda. Next is the board chair report, and I think I'll simply say that at the beginning of the month, I was able, along with our executive director and our other board members, to attend the statewide Community Mental Health Association winter meeting, and we were able to talk with members of other networks to further develop some ties with respect to, we all seem to be fighting the same battles, and find some unity in the things we need to do, and to talk about some strategy moving forward. So I'll leave it at that. We also want to note that we're going to have a new director of the statewide association, Alan Bolter, and we've had Alan here on several occasions, and we're looking forward to his leadership of that statewide organization at a very critical time. So with that, I'll call up our CFO, Robert Blumenfeld, for our finance update. And I do want to mention that we did have Robert last week, but we thought at our board meeting we'd like you to share an update through first part of the year.
Sure. Absolutely, and that is a tough presentation to follow.
It is.
But also feeling good about being here even more. Right. So, thank you. Overview on the finances. Just before we dive into the report, just super high level, we've got some pretty significant projects that we're moving forward. We're in the middle of our cost settlements, and that's gone well. We've negotiated some positive outcomes with some providers, and we've had some pretty good development of the team around coordinating with other parts of the organization. So for the end of the first quarter, December of 2024, our overall revenue picture looks a little bit better than it did for the same time last year. And I believe that you have the slides in your packets. And we're averaging about $33.5 million each month. Our eligibles are trending fairly consistent with last year, though last year was a downward trend. Where they ended up last year is relatively consistent, so that's good news. Our overall asset picture shows a shift between cash and receivables. Our cash is up a little bit, our receivables are down a little bit. Overall, in total, they're fairly consistent. And that often is a matter of timing when we get money versus when we bill for it. And our other assets and capital assets are relatively flat. Capital assets went down because of depreciation. On the liability side, our vendor payables remained relatively consistent since the end of the year on the balance sheet. And our overall net position for the month of December showed a decrease of about $200,000, bringing us through the end of the quarter to about a $2.2 million deficit in funding relative to what we're pushing out. Our overall revenue came in at about $115 million for Medicaid, which is the single largest part of our revenue, and that's about $6 million ahead of where we were same time last year. Our expenses came in at roughly the same number, and we had a slight increase in our relative administrative costs, but very modest. And I mentioned the outcome of our net income. So December was a a favorable month, relatively speaking, and hopefully we continue that trend of improvement. You should have a graph in your presentation about our top 15 providers, and I know I've mentioned in other meetings that Easter Seals and Mork are shown separately, but they will be combined coming into the second quarter. And you do have the financial statements themselves in your packet, but I highlighted most of I think the important things, for lack of a better description. And I am happy to field any questions, or if there's anything you want me to go through in more detail.
On the provider network, expenses, it's up about 14 million. Is that timing or the change from accruals, or, I mean, in some ways it's good, we're paying out more, but on the other hand, 14 million more is noticeable.
No, I think that you hit exactly what it is, and it's a change in how we're accruing things. We're attempting to show a more up-to-date picture as time is going on, rather than having sort of more volatile swings in the information that's being provided, or a drop-off toward the end of the year.
Okay, thank you.
Anyone else? Thank you very much, and thank you for the presentation last week. We went into a little more depth, but I think this gives a good overview. So.
Sure. Thank you.
Next, we have a couple of contracts that we have to deal with. First is the MCMI contract, which is for mechanical controls and maintenance. We did go over this last month, and this is basically a maintenance part of our HVAC system here at the Troy office building, which we need to have in place, and that's $75,000 item over the next 3 years, I believe it is. We have a motion?
Move for approval.
A motion? Support. And support. Is there any discussion? If we could have a roll call vote, please.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Giles?
Yes.
Pastor Jones?
Yes.
Dr. Guadalupe?
Yes.
Ms. Woodruff? Yes. Dr. Hans? Ms. Newman? Yes. Ms. Root?
Yes.
Mr. Torres?
Yes.
Mr. Cowan?
Yes.
Quorum.
Thank you. Next item is our Michigan Elevator, Inc. Elevator maintenance contract for the coming year in the amount of $25,000. And this, again, is our maintenance and repair contract for the elevators here in this building. Do we have a motion?
Move for approval.
Motion.
Support.
And a support. Is there any discussion?
Just to note, I mean, this is a 1-year contract extension, so it will go for bid.
Right.
Yep.
Right.
And the other comment, really, I was really excited about the fact that Mark said they're now placing a battery of some sort in the elevator.
Yeah, they're going to have a change.
That it automatically will go down to the bottom floor, so no one will be stuck in the elevator.
Right.
And I'm excited about that. I think that's a great move for us, because it certainly will eliminate a lot of anxiety. But the other part of it is it's just another safety feature.
Right.
And concern for the people in the building and those who visit our facility. So.
Technology is moving us forward constantly. So, all right, if there's no further discussion, we'll have a roll call vote, please.
Mr. Torres?
Yes.
Ms. Root? Yes. Ms. Newman? Yes. Dr. Hans? Yes. Ms. Woodruff?
Yes.
Dr. Guadalupe?
Yes.
Pastor Jones?
Yes.
Dr. Giles?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Okay. The next item is an extension of our contract with Raymond Robson for consulting services. This is for basically through the end of the year. This is continued work with our CFO and Raymond in the development of our budget and finance management systems. So we had a good discussion about this at the last meeting. We're hopeful that a portion of this contract may not be necessary in the future, but it is at this time, so I would place that before the board.
I'll move for approval, noting it ends 12/31/25, so the end
Right.
of the calendar year, not fiscal.
Right. Support. A motion and support. Is there any discussion?
The only discussion I'd like to add to that is, you know, and I want to compliment Bob on the work that he's doing, but the other piece of that, we talked about training our people, preparing them, and making our own organization a little bit more independent, and this does that. And so, you know, well, I want to say 2 years in the making, but you've done it. And so, thank you.
Thank you. There being no further discussion, can we have a roll call vote, please?
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Giles?
Yes.
Pastor Jones?
Yes.
Dr. Guadalupe?
Yes.
Ms. Woodruff?
Yes.
Dr. Hans?
Yes.
Ms. Newman? Ms. Root?
Yes.
Mr. Torres? Mr. Cowan?
Yes.
Motion carries.
Thank you. Next, we have the adoption and approval of our quality assessment performance improvement plan. This is a document that we are required to submit under our contract with the Michigan Department of Health and Human Services and have this program in place or plan. This is, I think, the same as many other institutions, including hospitals and whatnot, having a constant improvement program that we're not staying still. We're looking at new advances in the various disciplines that we serve or service in. So this is a rather lengthy report. It covers everything from training to credentialing to plans for the various communities we serve. So we did have a presentation last week about the report and from three of our senior staff to go over it and explain us in a little bit of detail. So at this time, I'll place this before the board for action.
I move that we adopt the QUAP report that was presented on last week at the committee of the whole.
A motion and support. Is there any discussion? Yes, Dr. Hotz.
I think there should be a summary of the report, or at least the key point or the areas that it covers. Of course, it's a 140 or 170 page report, so it's not possible to go through it, but I think that should be included in the agenda, the key points, because it is an important document that we have to submit every year to the state. So I would request that.
Okay.
Thank you.
Right. Thank you.
And if I could, Mr. Chairman, I know Dr. Hans brought this up. I mean, it was just an excellent report that was given, but she also mentioned some idea if they could bring forth changes that they would like to see in the reporting. And I think it would be good if we could add those. Here's some things we wish we could change or what have you in the evaluation of the data that they have received, or maybe there's another area that they need to focus on in that. So, you know, in concert with what you were asking, I think it would be good if we had that, because once we get the report again, it'll be similar data.
Well, I think it is required. There are key components of that are required by the state that we have to submit. But also, apparently our population is different. Our funding sources somehow don't cover all the projects or all the things that we want to do or what is needed. So at some point, whether part of this report to the board or as a separate presentation, we should know that what are our unique needs in our community as opposed to some others, or the challenges that we are facing.
Maybe perhaps at a study session we could have an update and find out what is happening on some of the key components.
yes.
Would that be something that would be?
Yes,
Good idea.
except that I will be out of town next week, so I
Well,
won't
no,
be
it won't be
free.
next week, but I'm
But,
saying
yeah,
at some point in the
and-
future, because we're just
yes.
adopting it, so,
Yes,
you know, maybe halfway through the year, and then, okay.
I
right.
think,
Yeah, I think we do get a quarterly
Quarterly,
update on this, yeah. So maybe, Dana, if we could get an executive summary just of some of the, I think this has been mentioned, because to go through 170 pages every quarter is kind of, I mean, there's some things we do the same because we have to according to state regulations, but especially if we got new programs or new initiatives, how are those going? Are there other things maybe that we're finding we need to change? I think if we gave a little bit more of that type of approach, that would be good. Okay?
I wanted to add too, so we also make sure it aligns with our annual report and our strategic plan and our annual needs assessment. So I think if we could comprehensively pull all those together and give you summaries of those high-ticket items. And I think, Dr. Hines, I agree with you with our grant programs. Funding is always at risk. So where are we at and where are we going? And that's why we're pushing, like, the data our guys are collecting over there is really critical to the funding and ongoing funding,
Yes.
which we know we're going to really have to continue to advocate for.
thank you.
Okay, thank you.
Thank you.
Can I just clarify? So we'd like a executive summary to be given quarterly and a
Right.
study session, or just?
No, we can do it at a board meeting or study session.
Okay.
Either one.
So, okay.
Do we need a?
Mr. Torres? Ms. Root? Ms. Newman? Dr. Hans? Ms. Woodruff?
Yes.
Dr. Guadalupe?
Yes.
Pastor Jones?
Yes.
Dr. Giles?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Yes, the next item we have is what's called the CIRC report, which is a summary of critical incident and risk event data, which we are required to submit to the state on an annual basis. And this does cover incidents, whether they be emergency medical treatment, arrests, other hospitalization, things of that nature, which you put in a higher risk event, so to speak, that happen to individuals who are being treated in the network, either through a provider or come into contact with law enforcement, et cetera. The purpose of this, in part, is to see if there's any trends. In particular, our reporting found there were no apparent trends that were impacting the number of incidents that occur every year. So with that, I'll place this before the board for adoption and submission. And we did cover this last week at the in depth at the COW meeting.
Support.
Mr. Chairman,
Yes.
I'll make the motion.
Okay, we got a motion and support.
Okay.
So, okay. All right. Is there any discussion? Roll call vote, please.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Giles? Pastor Jones?
Yes.
Dr. Guadalupe?
Yes.
Ms. Woodruff?
Yes.
Dr. Hans? Ms. Newman? Ms. Root?
Yes.
Mr. Torres? Mr. Cowan?
Yes.
Motion carries.
Next is our consent agenda, which is our routine approval of minutes from Recipient Rights Advisory Committee, Committee of the Whole, Citizens Advisory Committee, and Board Committee minutes from January.
Move for approval.
A motion and support. All those in favor say aye.
Aye.
All those opposed, the motion carries. Is there any other business to bring before the board this evening, not on the regular agenda? There being none, board reports, SUD oversight. Sarah's not here tonight. Yeah, sure.
We wanted to recognize you when you were recognized. I know you don't like this kind of thing, but We got something for you. You were recognized as a nonprofit board leader in Crane's Business Detroit as a notable board member for this year. So we want to present that to you, and that's it. He doesn't like this kind of thing. But congratulations.
Well, first of all, thank you, and I just want to say I really feel this way. I share this. I wish I could split it up into 12 pieces, but then nobody could read it. But I thank everybody for their support because of the organization, and I believe I share this with all of the board members. So thank you very much. Appreciate that. Okay, and thank you for not doing a big thing. Okay. Okay. So then we'll move on to Christina with Citizens Advisory Committee.
I do not have a report tonight because our meeting is tomorrow. So next month we'll have to circle back to February.
Okay, thank you. And then Recipient Rights Advisory Committee, Dr. Guadalupe.
Yeah, so our last meeting was held on February 6th. At that time, we had an overview of the electronic visit verification. We focused in on the committee's goals 2 and 4. So as a part of goal number 4, which is to get to know committee members and leadership, we learned about 2 of the members. As a part of goal 2, we reviewed in detail your rights handbook. And so we started with a deep dive and began with the first 3 pages of your rights handbook. Huge kudos to Vicki, who is teaching us all about the Your Rights Handbook and going through it. It's going to be a big task, but very important for the committee to learn about. So thank you. And then we had a review of the site visit report. And that is it. Thank you.
Thank you very much. At this time, we have the second opportunity for public comment. Is there anyone online? And again, please state your name and limit your comments to 3 minutes, and also address the board.
If you are online and wish to speak for public comment, please raise your hand at this time.
Thank you. Is there anyone in the audience who wishes to address the board? It's a cold night. I did not think we'd get a lot of people coming out for this meeting. So, all right. Yeah, that's right, except the 6 of you, so thank you. Yeah. So there's no public comment, and we'll move on. Next, we have our director's report. Dana, do you want to give us an update on your activities and the network?
Good evening again, everyone. For our February report, first of all, I just want to recognize Black History Month this month in celebrating the achievements and contributions of Black Americans across our nation, our state, and our county. So we also have programs here at OCHN that were way underway before I got here, so I have to give due credit to Christine and I'm looking at Trish, as well as Vicki and others, and our previous HR director, and now our new HR director, Nicole. We're continuing to work on our efforts through IDEA, which is Inclusion, Diversity, Equity, and Accessibility. So we're going to continue our efforts in that way. And really it's approach of how we serve our community in looking at individuals in respect of their cultures and differences, as well as how we support them through a holistic approach in that. The other thing I wanted to talk about was really focused on our access and crisis services, which really is the heart of what we do in terms of this program here represented also is part of improving access to services. So in their work, the guys over there, they are making sure that people are connected to those services, which is very critical. So you can see the numbers, they never decrease. And as long as I've been working in this arena, those numbers continue consistently to show. So just in January, just to look at access, we've had over 3,000 calls and 12,000 calls year-to-date, fiscal year 25. So that's really making sure that people have responses when they call us and request services. And then the other thing I really wanted to focus on as well is looking at our advocacy efforts and working with the leadership of our providers and making sure that they feel heard. We're having meetings tomorrow with our providers, but also meeting with some of the CEOs of the providers individually to resolve any issues or concerns they may have, but also figure out how we better collaborate and work together and have them join in our advocacy efforts as we go to the state to request funding and to request rates that are meaningful and reasonable for what we do so that we can push those dollars out to our providers. We are also standardizing our rates and moving to fee-for-service, which is a huge lift, but we're coming along smoothly. I'm looking at Robert. He and his team, as well as many other teams, are involved in those efforts. So we're making progress. We're not perfect, but we are definitely making progress in those areas. The other thing I wanted to highlight was our advocacy and collaboration with our annual legislative breakfast. Thank you for Mr. Cohen and Mr. Young being present in those meetings as well. Great turnout with the local county legislators, Board of Commissioners, as well as the newer state reps. And, well, we don't have a whole lot of new ones. A lot of people who are still in their positions for Oakland County and across the state were present here on that day. And we were able to really talk about our efforts, who we are, what we do, and making sure that they understand the critical importance we play in the community and serving this community. We talked about our accomplishments, also our annual plan and things that we're doing going forward, as well as our annual needs assessment, and hopefully you all will participate in that with the barcode or the QR code that's in my report. And then we also talked about some of our challenges with Medicaid eligibility and redetermination. And, of course, the ongoing efforts to advocate for our direct care workers in that minimum wage or their hourly wages. So those are the things that we focused on during the legislative meeting. A lot of good questions, a lot of good feedback. Those are one of my favorite events that we do annually. So it's really great to have our board participate in those events as well. The other thing that I'll really want to highlight is just to show that our work is really, the things that we're doing are really working to help the people in the community. So if you focus on our youth and family care connection, in looking at the number of requests that we received in January, 127. This is children or youth less than 17 years old. I think we go a little higher in some cases, but most of the time it's children or youth at 17 or younger. And so what we look at is the number of people that present requesting help, and really what's important is the number of people that, or young people who actually go to the hospital, but those who are also getting diverted from hospitalization. So the critical part of these numbers is that for inpatient, we had 93 people since fiscal year 25 go for inpatient stays. So that's huge. When you look at the number of kids that we have actually diverted from inpatient is 502. So sometime a few years ago, we got a lot of concerns from families that were coming because their young people or their children were waiting in the hospital EDs for days and sadly sometimes over a month. So with our program, the Youth and Family Care Connection with New Oakland actually providing those services directly, we're able to serve children and youth when they come to that center, as opposed to waiting in EDs for treatment. They actually get to engage in treatment right then and there. So those are the highlights of that report. The other thing I'll just close with real quickly is our collaboration that really makes everything work well. As we've seen earlier from the program, we also are looking at our collaboration with the county, Oakland County Health Department, as well as honors. And Kim and I were out to a new clinic that's coming to Pontiac as well. It is to replace our walk-in center that's at Pontiac General Hospital and really put it in the community and working with Honor. This is our ideal of an urgent care, integrated urgent care where the physical health and behavioral health services are being provided. And we were very fortunate to have the state's director, Hertel, be present in that tour and in that presentation. So a lot of good feedback, a lot of good demonstration of what happens when you put your funds together and really make a meaningful program. So there's data to follow soon on how we're impacting the community with having that program open, and when they open the new location, hoping to have even more people that we can serve and really refine those services and programs. And for that, I'll close.
Anybody have any questions for Dana this evening on the report?
Good job.
Yes.
You know, let me throw out this honor for the report, just excellent report and what we're doing, what our CEO is doing with the collaboration with honors, just excellent within the community. Certainly there's another clinic, Gary Bernstein Clinic, that does free services for the poor, the needy, and the indigent and all. Certainly hope that they will be a player in that activity, but want to thank you for what you're doing with Honors Health. And then, two on more personal notes on your work with E. Branner and E-Services, a young lady that's really reaching out, doing a lot of things for the Pontiac and very frankly, I think a lot of the Oakland County community with identifying to them services that's available, health services that's available. So kudos to you, Madam CEO, for your outreach and for your participation within the community. Thank you.
Thank you. May I add, Pastor Jones, also that with the Honor Clinic, we are also looking at the Bernstein Clinic. Christine Burke was actually at a presentation where a representative from the Bernstein Clinic was present, and she asked them about their behavioral health services, and they don't provide those services. So that's another opportunity for us to be present and make sure that people have access to behavioral health services as well. And then along with the other comment about the family empowerment and Isha Branner, she's doing some amazing things in this community, and I really hope that one day she can come and present stories that inspire hope. This young woman is just phenomenal in terms of the things she's doing. She's very progressive, and she also, some of the stuff that we've talked about doing here, like with mobile services, she actually has a van that she's going to roll out next month to make sure that people have access to services. So those are the kind of programs we want to make sure we partner with and support and really align with our priorities in making sure people have access to services throughout this community. And we also need to work on, and I know Sarah May was here, in the northern part of the county as well, because we do need those services to make sure we're covering. So we're making partnerships with some of the private entities that have more money than we do, and just making sure that we can partner with them if we can to make sure that we want those services to be available to anybody who wants and needs them.
Thank you. Anyone else? All right, that brings us to the end of our agenda, except for board member comments, and I'll start with Adam, please.
I think pretty much all of my other board members already commented tonight about the timeout group, so I think I will too. The one thing that really struck me about the presentation tonight was just the authenticity associated with your program, and when you meet people where they are, it really shows through, and it really showed through in the presentation tonight. So thank you very much, and as always, thanks to all the staff that put the agenda together, and everyone, stay warm, take care, and I'll see you next week.
No comment. Thank you.
Yeah, just to, as we listen to Dana's report tonight and all the services that are provided, we heard from Timeout all the services that they provided, that we have a lot in the community, and I just hope that folks are taking advantage of the resources that are there. This time, I think I mentioned at our last meeting, I mean, there's just a lot going on in the world right now, traumatic events for many people, stress going on, that we have so much to offer in the county, and I just hope that people are using the resources that are there to help them through these difficult times. Thank you.
John Paul?
No comment. Thank you.
Okay.
I just want to thank Dana and the staff for the excellent work that's being done. I was sitting here thinking how proud I am to be a part of this board and a part of the work. And we don't always agree. We don't always see eye to eye, but it's worth the fight to get to the place where people are able to get the services that they need. So I just want to appreciate again on time for coming and really blessing us tonight. As I said before, being a resident of Pontiac, I've had to endure meetings and trainings and different things where people didn't have anything good to say, and I wish the world could have heard tonight what some black men are doing in the city of Pontiac and really making a difference. So thank you again, and thank you, staff, for all your hard work.
Christina? Okay. Dr. Hans?
I just wanted to say about the RRAC handbook. I think that will be a good document for all the board members to have also, because it's important. We have QAPIP tells us what are qualities, and we always make the benchmark or what is required by the state or what state expects us to do. But RRAC still indicates what falls through the cracks. So I think the mental health core, or the summary of that pertinent to us and how the whole process works should be important. I think Vicky can probably make some extra copies for the board. Thank you.
Pastor Jones?
Again, thanks to the board, just an exciting board, and for the meeting today. And I certainly thank Suzanne for working with us in relation to the presentation that was given today, the hard work that she did in making sure we were prepared for this meeting. But then I need to ask a question, being new to the board. I understand that some persons, their term is coming to an end, and others will come on board. And one of our board members who has been just an excellent board member, and he's seen a lot of his ideas come to fruition. And with Bob coming on, that's Robert. Call him Bob, Robert. I call him. Well, I won't tell you what I call him, right? But at any rate, we're achieving a lot of the things that Mr. Torres have put in place and asked about. And so I'm not sure when his term will come to an end. One of my favorite, one of my. Is it in March? Okay, well then I got plenty of time then, because
the March meeting is going to have a roast part where I'm only.
All right, yeah, because one of my favorite foods is White Castles, and I thought on the day that we celebrate, or when he gets ready to step away, that we could just call Uber and have them bring in a bunch of White Castles for us. We can celebrate. But Mr. Torres, I want you to know I really have been engaged and happy and just informed by working with you, and I think I'm a better person because you being at that end of the board. Thanks.
Thank you. I appreciate that.
Thanks again for the stories that inspire hope in others, and I wish you guys all the best in doing the job that you're doing. Thank you.
Yeah, I'll echo what Yvette said. Thanks for coming. Thanks for sticking out. Pastor Jones is going to buy you gentlemen dinner for staying to the end. Very few of our guests do. Yeah. All kidding aside, I appreciate you guys being here and kind of sticking with it, and everything that you do in the community. Like I said, I worked at St. Joe's and now at OU with the OU Pontiac Initiative, so I've seen a lot of Pontiac over the years. So good job, gentlemen.
Thank you. First, again, thank you very much, gentlemen. Time out means a lot more to us now, having listened and heard from you and your inspiration. The two things. First, I just wanted to mention, everybody on this board always has somebody who has an influence on them, and my influence was Dr. Stephen Taub. When I first got on the board, he kind of took me under his wing. I did not have any idea what all these acronyms meant. I'm still trying to figure it out. It's alphabet soup. The accounting, he did the very best he could, and I think if I got half of it, he did a great job. So I wanted to acknowledge him, and I also wanted to acknowledge, I mentioned it last week, the passing of his wife, Shelley Taub, who served on our SUD Oversight Committee most recently, but was a county commissioner who was very supportive of our group. So if there's no objection, I would like to have us honor her and have her family here for proclamation at a date that's convenient for them, at a board meeting where we can honor Shelley for her service. She had a laundry list of public service, but a lot of it, if you really looked at it and studied it, revolved around serving the communities that we serve at OCHN, and she was very involved. And more importantly, on the legislature and at the county level, she made sure the money got to the right place. So we're very grateful for her. So if, without any further discussion, this meeting is adjourned.